You're all set.
Good evening. Welcome and thanks to everyone for tuning in. I'm Dr. Jennifer Mullendore, the Medical Director for Buncombe County Health and Human Services. And I'm excited for us to share information tonight about COVID-19 treatments that are available in our area. This discussion comes just before National Public Health Week, which starts next Monday, April 4th. This year, the theme for National Public Health Week is Public Health is Where You Are. And it's intended to pull focus to the many ways public health systems, organizations, and staff work round the clock to keep communities safe and healthy. The COVID-19 pandemic shed light on the work and importance of public health professionals, but another truth was revealed as well. For many people, this was the first time they realized that they had a role to play in the public health response. Each of us was responsible for reducing the spread of COVID-19 by isolating, getting tested, practicing the 3 W's, getting vaccinated, and now, as we will discuss further, seeking treatment for COVID-19. We are happy to be tacking treatment onto the list of steps available to the public and can't wait to dive in. We just have a few housekeeping tips. So we do have interpretation in Spanish and American Sign Language. So you may know that we're talking maybe a little slower. And we do hope to have time at the end to address some audience questions. So if you have questions, please submit them in the chat and we'll do our best to get to them. So tonight we have some really wonderful guests here to talk to us about COVID treatment. So what type of treatments exist, who they're for, what are their limitations, how well do they work, and where and how you can access these treatments. So I'm going to introduce our panelists first. So we have Dr. Stephanie Call. She's the chair of the Department of Internal Medicine at MAHEC. She is running the Internal Medicine Residency Program and has, over the last 2 years, been working with patients infected with COVID, both in the hospital setting and outpatient settings. And she developed and now runs the COVID-19 infusion program at MAHEC. So welcome, Dr. Call. We also have Grace Barnwell. Grace is the Director of Occupational Medicine at Mercy Urgent Care, a licensed family nurse practitioner. And during COVID, she led implementation of telemedicine, monoclonal antibody infusions, and COVID-19 therapeutic dispensing at the clinics in Buncombe County. So welcome, Grace. And we also have Dr. Chris Parsons. He's the medical director for the Center for Infectious Diseases at UNC Pardee. And he directed efforts for COVID-19 testing, treatment, and prevention at Pardee and the affiliated urgent care and other institutions from the very beginning of the pandemic. And he currently serves as the medical director of the Pardee COVID Infusion Clinic in Arden. So welcome, Dr. Parsons. Dr. Parsons is with us today over voice, but we don't get to see a picture. So you just imagine a brilliant doctor. All right, so we're gonna go ahead and get started. So for much of the pandemic, the only treatments available for people who were sick with COVID-19, but not so sick that they needed to be in the hospital, were limited to things used to fight other viral illnesses. Medicines that can help improve the symptoms of the illness, but can't fight off the infection. Things like acetaminophen or ibuprofen to decrease fevers and aches, drinking water to stay hydrated, and getting plenty of rest to help your body do its best to fight off the infection. But over the last several months, FDA authorized treatments have become available for those who are sick with COVID-19, but not needing to be in the hospital. Some of these medicines are pills taken by mouth, some are given as shots, and others are given through IVs. So Grace, we're going to start with you for our first question. Can you talk a little bit about who in general is eligible for these treatments?
Yes. So they're implicated or,
they're approved for people who have mild to moderate illness with COVID-19. And so you have to test positive to get that treatment, and you have to have symptoms of COVID. These medications aren't intended for people who need to be in the hospital, who have serious illness, things that have resulted in severe illness, such as requiring oxygen. The folks that really do well with these medications are those that feel pretty bad. So ranging from what would feel like a bad cold to a pretty bad case of flu is what we describe. And then we have to think about risk categories. And so these medications are intended for people who are at high risk and may have a bigger chance of developing more severe COVID illness. And so some of those folks, if we think about who that would be, are going to be people older than 65. Obesity is a risk factor as well. And then chronic illnesses like chronic kidney disease, chronic lung disease, chronic heart disease. And don't forget with heart disease, high blood pressure. So those are the folks that we tend to think of, and there's other illnesses as well. So your doctor can let you know if you have high risk factors that would indicate you should get treatment if you get COVID. Most of the medications are approved for ages 12 and older. However, with the pills, especially Molnupiravir, it is 18 and older. Cannot be pregnant and take those. So there's a few things that have been identified, and anyone prescribing would know those factors and let you know what is appropriate for you. There's also some weight limits, 88 pounds or 40 kilograms is another one. And then some locations, based on what they have for emergency treatment, the types of providers they have, may only treat certain ages. So at Mercy Urgent Care, for example, we treat 18 and older. We don't treat 12 and above. So keep in mind those as you look for someone. And then these are also treatments that have to be given in a certain time range. So people that qualify for the pills have to be within the first 5 days of treatment, and for antibodies within the first 7 days of symptoms. So the big message is don't wait. You've definitely got to test so that you can get your treatment started on time and prevent that severe illness from developing.
Thank you, Grace. And so that's kind of the broad overview. And so let's get into some of the specifics about the treatments. And so we'll start with the two that come in pill form, because that's, I think, how most people are used to taking medication. So Grace, since you kind of mentioned one of them, can you talk to us a little more about these oral antiviral medications?
Absolutely. So we've got two. One's called Paxlovid, and the other one's called Molnupiravir. And Paxlovid, interestingly enough, is actually a combination medication. And so there's two types of pills that come in the package. Very important that you take both of those. And then Molnupiravir is a single pill, but you take multiple of those for each of your dosing. So these are taken by mouth over a 5-day period. And there's a few important factors that you have to be aware of as a provider prescribing. And so we rely on you as a patient to tell us all these things so that we can make sure you get the right medication. So let's start with Paxlovid. You know, as I said, there's two pills in there. One of them you take 2 of, and the other one. You take them together, 3 pills at one time. However, some folks with kidney disease may be told to take a little bit less. So your doctor needs to know if you have any kidney problems. And the way that Paxlovid works is essentially it prevents the virus from making more copies of itself. And the 2 pills in there, one is doing that. The other one is preventing the first one from breaking down too quickly so that it can work longer in your body. So it's very important you take those 2 together so you get the best treatment possible. Paxlovid is 88% effective in decreasing or preventing hospitalization and death. So very effective medication. Again, intended for 12 and older, cutoff of 88 pounds. Again, 5 days, you have to start within 5 days of symptoms and take that full 5-day prescription. Now, people ask about, well, what are the side effects? And there are some rare ones, so muscle pain, change in taste, diarrhea, high blood pressure, but those are very rare. The more important things with Paxlovid is that there are quite a few interactions with medications. So it's absolutely important that you tell your provider who's prescribing it to you everything you take, even if it's an over-the-counter or a supplement, because it could cause problems with Paxlovid. So tell your doctor those things. And then again, we talked about kidney disease. Liver disease is also very important. We don't want to give people with severe liver disease Paxlovid either, because of the way it's processed in the body. It could be a problem for you. But otherwise, a very effective medication, helping lots of people really minimize the symptoms and get better faster. Molnupiravir also works by stopping the virus's ability to reproduce in the body, and it's 30% effective, so not as high as Paxlovid, but still effective, and I would certainly recommend it for those if that's the one that's recommended by your provider. This one is 18 and older. Can't be pregnant and take this because of problems to the fetus if you're taking this, and it can't. And all these medications are, again, not intended for people in the hospital, need to be started quickly so you don't end up there or reduce your chances of ending up there. Paxlovid, very rare as well to have side effects, diarrhea, nausea, dizziness. Those are the ones that have been reported, but very little of that. No medication interactions with this one that we know of so far, so very good on that front if you're on quite a few medications. So just the precautions about pregnancy, even for males, if there's a chance that your partner could get pregnant while you're taking the medicine, or even for 3 months after, making sure you're using good contraceptives with these. So that's the nuts and bolts on those 2 pills that are available.
Thank you, Grace. And I know early on we had in this area, and I think across the country, Molnupiravir was the main one available. But unfortunately, that was the one that was less effective. But recently, during March, we've seen more and more of the Paxlovid come into pharmacies and provider offices in the area. So that's really good news, since it is the most effective one. So thank you for sharing.
Yes, you're welcome.
The other treatments that currently are available come in the form of injections or medications given intravenously or IV. Dr. Call, can you talk to us a little bit about these treatments?
Absolutely. So one of the treatments is the monoclonal antibody infusions. There have been several of them. They have been around for over a year now, but we have been through an entire alphabet soup of monoclonal antibody infusions. Our current 2 infusions in use are sotrovimab and bebtelovimab, which I'm still struggling with pronouncing. And these will probably continue to change as the virus changes. So I don't think we're done with the new agents in alphabet soup. How do they work? These are infusions, so they are given usually IV. Some of them have been available intramuscular injection in the past, but our current 2 are available IV. They work because they are antibodies. So your body naturally makes antibodies. It's how you fight all infections. In this case, this is a synthesized antibody that has been made that is focused and specific to COVID-19. And really giving you this antibody gives you an early ability to attack the virus. Antibodies attach. If you look at the virus and there are proteins on the virus, the antibody attacks those proteins and makes it so that the virus cannot enter your cells. There have been multiple studies with the different monoclonal antibodies, and all of the studies have shown, most of the studies have shown that using the different monoclonal antibodies help to reduce the chance that you wind up in the hospital and are severely ill, that it reduces the incidence of death and reduces the virus replication in a person's blood. For example, in one study, using one of the antibodies that is available now, there was an 85% reduction in people being hospitalized or dying. So who is eligible for these? As Grace mentioned right at the beginning, people who are symptomatic, but not so sick that they need to be in the hospital, and people that are at higher risk of getting sick and getting hospitalized or dying. And so, as Grace mentioned, it is older patients, individuals that are greater than 65 years of age, people who have obesity, defined as a body mass index or BMI greater than 30, people with chronic medical conditions, diabetes, cardiovascular disease, liver disease, lung disease, and several other factors and conditions that go into this. The monoclonal antibodies are given IV, so you do need to go to an infusion center or clinic, such as Pardee or Mercy or Mayheg, to get the infusion. Currently, the two current infusions are given and can take up to 30 minutes, depending on the antibody, for the initial infusion. And then with all of our monoclonal antibody infusions, we monitor individuals for 60 minutes after the infusion. So if you're going to get a monoclonal antibody, you will be going to a special clinic or special infusion center, and you will be there for at least 90 minutes. These are indicated within 7 days of your initial symptoms or tests. And the side effects are, there are some side effects, there can be some side effects at the local infusion site. So where the IV is, there can be some redness, tenderness, soreness. And there are very rare but significant allergic reactions. And in the different antibody studies, these happen as low as 1 in 1,000. So very, very rare, but something that is what causes us to monitor each person for an hour after the actual infusion.
Thank you, Dr. Call. Dr. Parsons, Pardee also offers Remdesivir, which is another COVID-19 treatment given. Can you talk to us a little bit about that?
Sure, thanks, Dr. Mullendor. And I'm sorry, everyone, that you can't see me. But Remdesivir is an antiviral drug, but it works a little differently than the monoclonal antibodies. It actually works inside the cell to prevent the virus from replicating. And Remdesivir has been in clinical use for a couple years now. It was originally approved for use in patients in the hospital. More recently, there was a large clinical study trying to determine whether it was useful for patients who were not in the hospital, using a 3-day course of treatment. So that involves an IV infusion similar to the monoclonal antibodies and lasting about a half an hour. And that's one infusion per day for 3 days total. This is a little different than the monoclonal antibodies because it is fully FDA approved, so you do not have to wait after your infusion for an hour under observation. But that study demonstrated that it can reduce your risk of hospitalization and death by about 87%. So the value of this 3-day treatment is just as good as the monoclonal antibodies. It also reduced your need for subsequent medical visits, and it significantly reduced the time to resolution of your symptoms. And so it really was a useful tool for us in addition to the monoclonal antibodies when we had so many cases of COVID-19 in the community and we needed as many treatments as we could get. It has been approved by insurance companies, and it's available at the Part D infusion unit currently. And it is most effective if it's given within 5 days of when your symptoms start. There are really no specific medical conditions that would make you not eligible for Remdesivir. There was some concern early on that if you had kidney disease, that Remdesivir might build up in your system. And actually, there's a component of these infusions that's called an excipient, but essentially it's not the drug itself, but something that comes with the infusions that can build up in patients with poor kidney function. But fortunately, information has been recovered, which suggests that patients with poor kidney function can still receive this 3-day treatment of Remdesivir safely. The most common side effects are nausea and rash, but those are still relatively uncommon, occurring in only about 3% of folks who receive treatment. And those are the main points.
Thank you. And then Part D also offers a medication that can be given to prevent COVID-19 infection in certain individuals. So what we would call pre-exposure prophylaxis. Can you tell us a little bit about that medication?
Sure. The name of that medicine is Evasheld, and it's a combination of 2 antibodies in a single treatment. And unlike the other monoclonal antibodies you've been hearing about here, this Evasheld was studied in a situation to determine if it could be used to prevent COVID-19 infection rather than treating an active infection. And there was a very large study called the PROVENT study, which patients who received 2 intramuscular injections, and so this is not like the other infusions where you need an IV, but this is given more like a shot, like a standard vaccine in your arm or in your thigh potentially. So patients who received 2 injections at the same time of these antibodies, there was about an 80% reduction in risk for infection compared to patients who received the placebo in the study. And then the good news was that they looked out over a 6-month time frame after a single treatment, and the degree of protection against infection was still very good, actually over 80% at 6 months. So it's quite helpful in the right person for preventing infections. The patients who really should be considered for these injections are those at very high risk for more severe COVID infection and hospitalization. So that includes patients over the age of 70 who cannot receive vaccines due to an allergy or a reaction to a previous vaccine, patients with high body mass index in that same situation, or patients with either chronic lung disease or patients with severe immune compromise. And that last group of patients, typically those are folks receiving medications for various diseases that affect their immune system, patients with cancer or patients with organ transplants. The eligibility for patients really depends on the individual and their degree of how well their immune system works. And so we can always evaluate, patients that can be considered for this treatment to see if it's right for them. Evasheld these injections are currently offered at the Part D infusion unit in the Part D Cancer Center. And so patients can be referred for treatment with those injections. It's not known entirely how well it prevents infection with the newest forms of COVID-19. Those are the Omicron variants. and it's not meant as a replacement for vaccines, because we think that the vaccines likely work much better long-term to prevent infection, especially with the new Omicron variants. So this is not meant to be a substitute for a vaccine. This is meant really for people with poor immune systems or people who are at high risk who cannot receive vaccines.
Thank you. Yeah, that's what I was going to say. That's like the message I don't want people to take is it's some medicine I can take to avoid getting a vaccine, but it's really for those people who, yeah, like you said, the vaccine would maybe not be effective and them as effective in them because of their weakened immune systems, or they have some medical reason that they can't get the vaccine. So yeah, thank you for emphasizing that. All right, so now that we've gone over the variety of COVID-19 treatments and preventive medication, the big question people may have is, okay, so I meet those criteria, or I may meet those criteria if I get COVID-19. So where and how could I access them, or where could I go to get more information? And so I'm going to put this to all of you, since you can speak to your own particular clinics, and then we'll see if there's anything else left to say. So let's start with Grace. Do you want to start us off with this? How would people access these medications, maybe at Mercy or in general?
So in general, there's various locator tools that you can use that are on the internet. One of the most recent ones is called Test to Treat. And the idea is that you would get tested and treated all at the same location so that you have less of a runaround. Mercy Urgent Care is a Test to Treat location, and I think there's lots of folks in the area that have that, but you can look up Test to Treat and the locator will direct you to the closest place you can get both tested and treated. And it should and there's indicators that tell you what medications are available at these different places. At Mercy Urgent Care, we provide antibodies, so sotrovimab and bebtelovimab, and then we also provide the oral pills, so molnupiravir and Paxlovid. So those are the medications that we're focused on providing for the community. And anybody can go to our website and fill in a request to come for that treatment. You can go on our website to sign up for an appointment to get tested. And if you test positive, you can request treatment for that. Typically, we can give you the medication, the pills, same day. Sometimes for the antibody infusion, it'll be next day, just depending on timing and availability of the nurse. But we're able to give the infusions within 48 hours of request. Very mindful of the times that you have to be able to get these medications, that 5 days for the pills, 7 days for the antibodies.
Thank you. And I know early on, many places required a provider referral, but the perk of Mercy was, well, you're in urgent care, and it was sometimes people were able to self-refer, right, and get, like you said, tested and get the treatment from you, and now officially Test to Treat. So that's great news.
That's correct. And, there were a lot of restrictions, placed by the federal government initially so that they could get the medications to the people who needed it the most. And because there was such a low supply, now that supply has improved, we can give more patients these treatments. So a very good thing. Also, we were required to do a clinical test. Now we can accept a home test. Of course, check with your provider. They may still require that, but at Mercy Urgent Care, if you have a home test that's positive, we can take that result for you and get you treated.
And that's really good news, because as we know, home tests are much more available now, and many, like I myself, have used home tests in my family. So that's really good news to hear that those are actually being accepted now in places. So thank you. Dr. Call, do you want to talk a little bit about MAHEC's process?
Yes, and I'd also, before I talk about MAHEC, highlight 3 things. One is this does change rapidly as the pandemic changes. And as Grace mentioned, when we're very busy, this becomes a scarce resource and things change and criteria change. And the one thing I would say, I moved here 2 years ago, right at the beginning of the pandemic. And one of the things I've been most impressed with is the collaboration across sites. So if we're really busy and we tell you, Mercy's got this or Party's got this. So that's been really impressive about working in the region. Something that I've very much valued is the collaborative efforts. So it is worth, if you're lost, calling any of us, and we will try and direct you to the place that has the most X, Y, or Z. The other thing I'd highlight is the role of the primary care doctor. Your primary care doctor is your best advocate and can point you in the right direction and help guide you to what you might have that meets specific criteria or specific considerations towards specific therapies, and then refer you to a site. And then the last thing I'd highlight is the North Carolina Department of Health and Human Service website, which is really great for up-to-date information and has a fine treatment section, which can be really helpful. We have very much at MAHEC, depending on where we were with the pandemic, been able to offer open resources and then scale back a little bit. Right now, we are able to serve the wider community in a testing venue and then refer you to treatment. So we can do test and treat. We can also take direct referrals from physician offices, primary care doctors. We have a lot of information on our website. If individuals just Google MAHEC and COVID, you'll come to our website, and it has both the referral process, the phone numbers, and how to make appointments again for testing. Our treatment, we offer the monoclonal antibodies and the testing, and then prescribe the oral medications, but don't have them on site at this point in time.
Thank you. Yeah, and I think you make that good point about if you have a primary care provider, reach out to them. I'm communicating with primary care providers information when it comes to me, and hopefully they're all aware of that website. If you want oral antivirals, they can write a prescription and you can take that to a pharmacy that's on that list. And we have many, like Ingalls, CVS, Walgreens, and some more independent pharmacies now are stocking one, and now many are stocking both of those oral antivirals. And so that primary care provider can help you with that. But then we have our urgent cares and these sort of more specialty COVID-focused clinics that can help you out if you don't have a primary care provider. Dr. Parsons, can you talk to us a little bit about the process for Party?
Sure. There's a patient access line that you can call to get information about how to get referred to the COVID infusion unit at Party. That phone number is area code 828-694-4322. And much like what Doctors Barnwell and Call just said, we accept referrals from primary doctors and test results from home or any other location. And the Party unit offers infusions with monoclonal antibodies. For right now, that is bebtelovimab. That's the newest monoclonal antibody that Dr. Call was referring to. That's really the only one active currently against all of the existing types of COVID-19, including this new BA2 type that has emerged over the last several weeks and now comprises the majority of infections in the US. In addition to that, we do offer Remdesivir as an alternative. And once again, the difference there is that with the monoclonal antibody infusion, that's a one-time appointment. And with Remdesivir, that's a three-day course of treatment. And if you have questions about which treatment is right for you, then your primary doctor is always the best resource, but you can also get in touch with members of our infusion center using that phone number I gave you a minute ago. So it's 694-4322. Party pharmacy and providers at the Party urgent care locations can write prescriptions for the oral therapies also. And we would always encourage the use of the oral therapies if we can, so as to avoid any of the need to come for an IV and for an infusion. And as Dr. Barnwell mentioned earlier, the oral therapies are very effective, Paxlovid in particular, but even Lagevrio can be as well, especially for patients who are vaccinated, for example, or maybe a little bit lower risk.
A question that has come up recently, and that I don't know that any of us on this panel are going to be able to fully answer, but it's a question that I've been getting more and more frequently from other providers, is so the federal government program, the program that was paying for testing, treatment, and vaccination for uninsured individuals has run out of money and has not been allocated any additional funds at this point by Congress. So the question comes, how are uninsured patients going to be able to access these treatments? And so one thing is, so the medications themselves are still free, right? So the pills, the monoclonal antibodies, I'm not going to say Remdesivir, but the others are free. And so the question that I'm still trying to get answered is, are pharmacies charging a dispensing fee for those pills? I'm not sure. I don't know if anybody on the call knows that answer yet. We're actively trying to get that answer today, and so I don't have the answer right now. But that would be maybe the only cost, if there is any cost to uninsured patients, for getting the med. I mean, I can't speak to what a provider visit might cost, right? But I don't know if any of you, has that come up yet for any of you, or have your clinics are you trying to work it out now? Do you have any thoughts about what we're going to do for our folks who are uninsured? And it's okay if the answer is you don't know yet, because like I said, I don't know yet. And we're in contact with the state to see if they have any ideas, because this just came about quickly within the last week. So I don't know if any of you have anything to say, feel free to unmute and let us know.
It's Chris here. At least for the time being, I do not believe that uninsured individuals are charged a dispensing fee from the Part D pharmacy, at least for the oral medications. The details of how that works moving forward, none of us really know beyond that.
Yeah, and so I would say anybody who is uninsured and listening, I would again just encourage you to reach out to your primary care provider. This isn't, as it has been since goodness last 2 years ago. It's an ever evolving situation. I feel like I've said that 1,000 times. And so like Dr. Call said, we're a very collaborative community, a very engaged community of providers. And so if we find out what the answers are to this, we'll share that broadly. But just if you meet the criteria for treatment, don't hesitate to reach out for treatment. And hopefully we'll have answers at that time and get you what you need so that insurance is not a barrier, cost is not a barrier. So more to come on that. All right. So treatments are wonderful and we're really glad we have them, but they're not a substitute for prevention. So let's talk a little bit about that. So Dr. Call, we'll start with you. Like, what are your recommendations on how to prevent COVID-19? If anybody needed reminders of this, but let's bring it back to prevention, which is our ultimate, right? That's what we want to do, prevent.
Well, and I think it's important as we talk about prevention that it is about protecting yourself and protecting those around you, our community. So this is something that we can all play a role in for ourselves and then for everyone else in our community, our loved ones, our friends, the people that we run into on the street. So a couple of really important things. One is follow public health guidelines, and those change. So keeping up with public health guidelines, masks, distancing, that changes based on how common COVID is in your community, and people are very thoughtful about making those recommendations. So keeping up with them and then really complying with those is important. vaccination, including booster shots. And again, those recommendations change. And so getting your 1, your 2, your 3, and your 4 as that comes out is really important. Testing early and getting treatment early. The number of people that we have all seen that have had a little bit of a sniffle or a little bit of a viral syndrome and thought, I don't think I'm really sick, but I'm kind of sick, but I'm not really sick, and wait. So staying away from others if you're not feeling well, and then testing if you're sick and seeking treatment early if you're positive, I think is so important. Being even more careful if you are immunocompromised or if you live with immunocompromised or unvaccinated individuals. And then again, seeking treatment early if you are tested positive, and staying away from others, I think are a couple of the things I would think about.
Does anyone else, Grace or Dr. Parsons, have anything to add?
I would just say that I think we all have a role of, talking with coworkers, family, and just, those around us, and encouraging them, if you feel poorly, please get tested, and remind them that treatment has to be early. So that's another reason to get tested besides, preventing the spread. So, having those conversations early and helping people really formulate a decision ahead of anything happening really can help when that does occur, to encourage people to stay out of the workplace or get tested, get treated quickly, and help the whole community reduce the spread.
Yeah, and I can speak from the public health perspective of I can't even count the number of clusters and outbreaks of COVID that we investigated because somebody went to work sick or went to a family gathering sick or a party sick. I mean, it was entirely preventable, but we just didn't follow the guidance that was given. And I would also say that, especially with Omicron, we saw people who had essentially done everything right in terms of got vaccinated, as fully vaccinated as they could be, and they still got sick. It doesn't mean the vaccines failed. The vaccines kept them out of the hospital. The vaccines kept them from dying. But those people still, like, these treatments are for you as well, right? So just be mindful of the wide spectrum of things that can prevent and then also help you recover. And so don't hesitate. Again, reach out to your primary care provider, reach out to a provider and ask questions if you have any. I don't know if Dr. Parsons has anything to add for that one. If not, it's okay.
Yeah, all that information is so important. I would just add a couple of comments. First, about vaccines, that we learn more and more about how helpful these vaccines are, month to month. And just a couple things to mention that have come to light a little bit more recently, that if you're vaccinated and boosted, that dramatically reduces transmission to those directly around you, including the household. So the existing data indicate that even with the newer variants, household transmission of COVID-19 is reduced by up to 40%. So as Dr. Barnwell mentioned about being aware of who you're around, maybe family, friends who have immune system problems, being vaccinated yourself is really helpful for those people. The other thing that we're not touching on in this phone call about long COVID or the more long-term effects of COVID-19, there are several studies now that indicate that if you're vaccinated and then get infected later, the chance of you having lingering symptoms even as far out as 6 months is dramatically reduced. So it's quite likely that these vaccines prevent, the long-term complications of COVID. We don't have all that information yet, but that's where the information seems to be heading. And the last thing I'll say is that everybody is sort of getting away a little bit from using masks. I would say that if you can't get vaccinated or you have immune system problems, or you know you're going to be in a crowded area and you happen to be somebody who has significant medical issues, then there's no doubt that masks still prevent infections. And since people have been taking off masks, we've seen more other colds and viral infections. So I guess I'm giving you a little bit of inner strength, if you will, to feel like you shouldn't be ashamed if you continue to wear a mask in a crowded space, if you can't get vaccinated, especially, or if you have immune system issues.
No, thank you. Those are all really good points. And thank you for bringing that up. Yeah, I personally, we're in a low community level, but it's been kind of I don't know, a shock to my system, I guess, sometimes, to like, can I really walk in here without a mask on into this grocery store or into the store? And I just listen to like, what am I comfortable with? What's it matter? If it's more comfortable for me to walk in with the mask on, then I don't, yeah, just I think people need to, again, that's the message, right? You need to evaluate your individual risk and do what's best for you and those around you. And so, yeah, thank you for giving that support to those who want to keep wearing their masks. So we'll wrap up with this last question, which is basically a summary. So if our audience could take just one piece of information from this event, what would you want it to be? And so we'll start with Grace. What's your one tidbit you would share with everybody?
Test early, treat early.
I like it. Dr. Call, any last words?
I will amplify that. Test early, treat early.
And Dr. Parsons.
Get your vaccine and your booster shots.
Yes, hear, hear. I don't know if we have any. Here we go. No questions. So if this is the time for those of you watching, this is the time to reach out and put your questions in the chat. Yeah, and I'll fill some time while we're waiting for that. So we talked about boosters and how things change, and so this week, right? The FDA authorized and the CDC put out information about second booster doses for certain individuals. And if it's confusing to you, it's not because, it's because it's confusing, because the guidance, there's different vaccines and different time frames for them and different recommendations. So again, reach out to your primary care provider. You can go to the CDC website and try to interpret it. The state did just send out standing orders for health departments and providers. So we should all be now, as providers, able to administer those second boosters to those who are eligible. And again, I think getting as up to date on your vaccine as you can, but also like talking with your primary care provider if you're not sure about timing, or if you're in the right group to get those second boosters. Don't, it doesn't hurt to ask. But we really want, the more people who are up to date on their recommended vaccines, the better we are, right, as a community, and keeping people safe out of the hospital and out of the grave, as I say. So thanks to those of you who have stepped up to get your vaccines. And we have the Spring into Summer. That's the state's campaign, right? So we got summer camps coming up for children. And we knew we had some clusters and cases and outbreaks at camps last year. So we're hoping that we can get all those kiddos and counselors vaccinated so that they don't end up needing these treatments and therapeutics that we just talked about. And we're still waiting on information about vaccine for young kids, babies up to 4-year-olds. So expect more information and more updates to come over the next month, which is what it is when you're in a pandemic, right? Does anybody have anything else that they would like to say? Otherwise, I think we can wrap this up early. All right, so thank you so much to our panelists. Thank you, Dr. Call, Dr. Parsons, and Grace for spending your time with us and sharing your knowledge. And we hope everybody out there watching and listening found it beneficial, and that you now have the information you need to take the best care of you and your family members. And again, oh wait, question just popped up. Let me see. All right, I'm just going to read it, and you all can, one of you can answer it. The question is a healthy 65-year-old person more likely to have a serious complication after a COVID-19 vaccination or a serious side effect after taking a COVID-19 drug, such as an oral medication, monoclonal antibodies, or Remdesivir? I mean, I would just say serious complications from vaccinations and these meds are extremely rare. I would say the serious complication would be from the COVID infection, right? Like that's going to be what's more likely to cause you to end up in the hospital or worse. But I'll leave it to those experts who actually administer these treatments.
Yes, I would certainly agree that they're less likely to have problems from the medication and much more likely to benefit from taking them, because remember that 65 and older increases your risk of complications. So getting the vaccine is going to reduce that risk. If you end up with COVID, whether you've had the vaccine or not, and you're 65 and older, your next line of protection is going to be taking those medications to try to prevent that severe illness or hospitalization. So if anything, I would say these folks are the ones that need to be seeking these vaccines and medications.
Great. Dr. Parsons.
Yeah, I would. I would add to that in the vaccine trials, older patients were actually less likely to have complications of the vaccination. We tend to see less issue with patients 65 and older.
Yeah. Excellent. All right, so the message stands: get your vaccine, and if you get sick, get tested early and get treatment. All right, so thank you again to all of you participating, and we hope that you have a safe and healthy spring, and we'll have future Let's Talks probably about new changes and updates to COVID guidance. So thank you all very much. Have a good evening.